I completed my research on the psychological response for both the family and the patient that accompany false positives, false negatives, and disease diagnosis. When receiving a false positive from a diagnosis test means that you do not have the disease, but the test indicates that you do. Receiving a false negative from a test means that you have the disease, but the test indicates that you do not. When given a diagnostic test, doctors realize that a certain amount of tests will come back as a true positive or true negative, meaning that the diagnosis is correct. However, in some cases, the diagnosis is not correct, thus yielding a false positive or false negative. This is a very prevalent problem, as no diagnostic test is 100% accurate. In tests, outliers, human error, improper sampling, and complex diagnoses ensure that there will always be false positives and false negatives in a large sample population. The psychological response that a patient encounters as a response to this incorrect diagnosis is what I completed my research on. These responses could be grouped into 4 categories: false positive effect on patient, false positive effect on family, false negative effect on patient, and false negative effect on family. First, I will explain the psychological response for a patient in the case of a false positive. My research shows that the patients will experience extreme stress until they have an absolute diagnosis. For a false positive, this applies, as with any positive, they have to wait, often days before receiving a diagnosis, inducing stress as to whether or not they have a disease. This idea was examined in a study at UC Davis where experimenters administered a retrospective survey to understand the stress level in patients with false positives and immediate further diagnostic testing compared to patients who were called later for further imaging. Results showed that stress level was significantly greater in the group that had to wait for further testing as compared to the group that got an immediate diagnosis. This means that providing an on-site diagnostic test can very much reduce the stress level for a patient who have received a diagnosis, and that patients should leave the hospital with a confirmed and absolute diagnosis. Second, I will explain the psychological response of the family in the case of a false positive. When the patient's family faces a false positive, their grief often comes in 2 stages. First, they cling on to the patient, and then they lose attachment with the patient. This comes in accordance with the stages of grief, where originally the family does not want to let go of the patient, and as they come to terms with the trauma, they can accept it and let go. This idea was exemplified in a study comparing infants whose metabolic disorders have been correctly diagnosed to infant patients who had been falsely diagnosed with having a metabolic disorder. Results from the study showed that more mothers who received a false positive said their child required extra care in early 3 years as much as mothers who received a correct diagnosis. Further, over time, there was much more conflict reported between the child and their parents in patients who have received a false positive. The conclusion from the study is in accordance to my research, showing that false positive screening results led to an increased parental stress in the short term and eventually led to a diminished parent-child relationship. Third, I will explain the psychological response of the patient in the case of a false negative. Primarily, the chance of receiving a false positive on a diagnostic test leads patients to lose confidence in the medical community. In the case of breast cancer diagnoses, research shows that mammograms only diagnose breast cancer correctly 30% of the time. The patients react to this number by concluding that they do not want to receive a breast cancer screening by mammogram because the invasiveness of the machine is not worth the off chance that they receive a correct diagnosis. Their lost confidence in the test leads breast cancer screening candidates to lose confidence in the medical community, resulting in an underlying fear of developing breast cancer and not knowing. Lastly, I will explain the psychological response for the family in the case of a false negative. When a patient's family faces a false negative, there is often a time delay with a psychological response. This idea was examined in a study designed to determine the psychological challenges for patients with children with a false negative result for Down syndrome. The results from the study showed that parents adjusted well to having a child with Down syndrome, regardless of the screening history at birth. However, once parents could adjust to and understand the situation, parents had adverse effects to parental adjustment 2 to 6 years after birth. This study showed that over time, the blame for a false negative would build up, and often the family have a drastic psychological response of anger and refusal. With the high prevalence of false positives and false negatives in disease diagnosis, it is important for doctors to repeat tests and approach the diagnosis different ways. Due to the extreme variability between cognitive appraisal and people, the following psychological response can be substantially different between people, making it difficult for a doctor to know how to comfort a patient. Therefore, doctors need to verify across tests to ensure statistical assurance that the result is true. Otherwise, the patient and their family may be forced to experience unnecessary protocols, stress, and unwanted emotions.